So, a few days ago, I went to the hospital. My friend, she convinced me I should go. I went to the emergency room because I was having testicle pain. And I had myself all psyched up, wasn't going to go. I pictured, what kind of tests would they do? And I bet they would hurt a lot because I was already in pain. Like pull out one of those little hammers and start hitting on you or something. Years ago, I went to a doctor and went for an ear infection. It's like 30 years ago. Ear infection, ear all stuffed up. And it ended up him putting on gloves and looking for lumps in my testicles. I'm thinking, I don't think that has anything to do with the ear infection, because I'm smart that way. And it wasn't a pleasant experience. So anyways, I go to the emergency room and I'm what you call a problem patient because, I'm advocating for myself, that's all. And it wasn't that bad. Matter of fact, it was so nice that if I had really good insurance, I might go back next Thursday. Because basically it came down to a sonogram on my testicles. And it wasn't that bad at all, really. And so now I'm hopped up on antibiotics for like the next 10 days. But, keep your fingers crossed. There's something really liberating talking to people about things like this, though. Because when you go to the hospital, I don't talk to people normally that way. Usually I'm clean and don't talk vulgar and things like that. And then you get to the hospital, and once you start talking about your testicles, you can't stop. If you followed me around for 4 hours at the hospital, I wrote down stuff that I heard, or that you would have heard, following me around. Intake female nurse. I never had testicles, so I can't tell you. Meet to doctor. Since the further descending after I turned 50, they are extra sensitive, probably more than most, but I have nothing to compare them to. Doctor points to unspecified female in room. This is Jenny. She will just watch. Now, let's look at your testicles. Me. Resisted asking Jenny if she comes here often. Me to doctor. Sorry, I just coughed all over you. Me. Is that somebody's dead skin and scabs all over the floor? It was. Me to female sonographer. I have no pain when I have an erection, but I can't walk around all day with an erection. Sonographer, female. I will give you privacy while you prop them up on this towel. Me. If you're not going to close your eyes throughout the procedure, I don't think we'll have to consider privacy an issue. Sonographer, female to me, while gliding wand over my lubricated testicles. I like pregnant women the least. Me to sonographer while working with testicles. I bet people ramble a lot to you, including me. So I guess bask in my genius and enjoy the show. Might have crossed the line on that one. Me to hospital staff. First time in my life I'm rooting for an infection. Me to myself. Why did I bother taking off my socks? So if you're a male, go seek help. And also if you're young and you have a bucket list, and on that bucket list, you have go to Italy and you have read Moby Dick. Read Moby Dick when you're 50, because you can sit in a chair and do that. Go to Italy now, because when you turn 50, you'll be wheezing, you'll be limping, and most importantly, you don't want to be walking around with angry balls. For now, it's me, Camroy, here on YouTube.